There's really 3 different ways to do the biopsy. If you can see it on ultrasound, that's a fantastic way to biopsy a lesion. That's an ultrasound-guided coordinatal biopsy is typically what that's called. You get a fantastic sample of tissue. It's well tolerated with the patient, typically just with local anesthetic, and that works out really well. And the second way you can do it with stereotactic imaging. That's where you're actually using a mammogram, which a mammogram is a fancy X-ray. It's really all it is, to coordinate and find that lesion and do a biopsy. And that's probably the second most common way. And the third way is something called an MRI-guided biopsy. So those are for lesions that you only see on MRI, and then you go to an MRI-guided biopsy, which is technically a little bit harder to do, but will also get you good results. And occasionally, it will not be amenable to any of those 3 ways of getting that tissue. And so that leaves you with a surgical biopsy or an open incisional biopsy. And that's if you can't get it with a needle, if it's too close to the chest wall, too close to the important thoracic structures, then it would maybe something that has to get biopsied in the operating room.
So needle-based biopsies, either using the ultrasound machine or the stereotactic machine, those are the most common biopsies. These are outpatient procedures, extremely well tolerated, kind of like going to the dentist, but sometimes even easier. For the ultrasound-guided biopsies, they're done with the patients laying on their back. Ultrasound is used to find the small mass, and then we numb up the skin and the underlying breast tissue with a small dose of local anesthetic, similar to what one gets at the dentist. And then a tiny little nick in the skin, and under ultrasound guidance, a needle is placed into the lesion or the mass to get the tissue out. Same kind of procedure for the stereotactic, which is the mammogram-based type of getting the needle, using a needle to do a biopsy. The lady is on her belly for that. So they're both done under local anesthesia, very well tolerated, no stitches involved, just a little Band-Aid. The ultrasound procedures are usually for a single spot in the breast, usually well under 10 minutes. And for a stereotactic biopsy, it's usually around 10 to 15 minutes and very well tolerated.